name is Myrto. I'm 23. I was diagnosed with multiple sclerosis in 2003 and the doctor was Dr. Bernard Infeld.
Dr. Bernard Infeld?
Yes.
And that's a neurologist?
Yes, that's a neurologist.
Okay. And what's the name of your general practitioner?
Abraham Mass.
Dr. Abraham Mass.
Yeah.
And where do they come from?
Melbourne.
In Melbourne,
Yeah.
okay. And these are your parents, Harris and Sophia. Now, did they do tests to come up with the prognosis that you had MS?
Yes. He told me I had MS straight off because I went there and he did those tests and he did my reflexes. Told me it was MS and I did an MRI and I had the lesions and then he said just to be sure you need to do a lung puncture and that came out clear.
So the lumbar puncture didn't show any support for the fact that you had MS, is that correct?
No, it was fine.
It was fine. So that test failed?
Yeah, it was pretty much just
in indicating MS, yes.
Last year they found something, LDN, you know it?
LD?
LDN. It's in one drug.
So did you try that drug?
Yes. Yeah, I'm on it now.
Yes.
My GP prescribes it to his patients. But from what I've gathered, I haven't had much improvement. So.
How long have you been on it?
About 6 months now.
So if you don't get improvement in 6 months, it's not going to work, is it?
Yeah, that's what we think.
I'm thinking of using it getting off, but I went there hoping that this could help me. And they just threw it back in my face, and I was about to cry right there and go, why are you not helping me?
They're not trained to help you. They're trained to tell you, they're trained to tell you you will never get better. They're trained to take away your faith and your hope that you can get better. It actually goes against Christian ideals. Your daughter doesn't have MS so severe that you can notice any real symptoms in her. It's just the walking and the running thing, isn't it?
Yeah.
What's your worst symptom?
My right leg is pretty weak, and fatigue. I get really weak. I get just a spurt of weakness for about 15 minutes. I just feel like I want to collapse.
Okay. And when you walk, can you see there's a problem with the right leg?
When I first start off, no.
You can see it.
I don't feel it so much, but if I walk for longer, yeah.
I can see it. Walk a few minutes, you can see the leg.
Kind of drag it a little bit.
I can see it right away.
Can you jog at all? How long has it been since you've been able to jog?
Years.
4 or 5 years?
3 or 4 years. Yeah.
So for 3 to 4 years, you haven't been able to jog at all? All right.
My toe actually has a sort of certain pain, but it's lower than my nail. I haven't really hit anything, but when I press it, it's sore.
So on the bottom of your toe, when you press it, it's sore?
It's sore, and it kind of affects me when I walk.
Alright, so what I'm going to do is I'm going to press a nerve in your back here. I'm going to find, does that hurt there, does it?
Yeah, it's
All right.
sore.
That's the lump that I was massaging. So I'm going to press on it. I'm going to just work it a little bit first. Is it still hurting?
I can feel it.
In your toe?
Yeah. I
Okay.
can feel the pain.
Okay, so now press your toe and tell me if it's still sore when you press it.
Yeah. I can even feel it when you were doing it.
When I'm manipulating that.
Yeah, I can feel it.
So I'll massage that particular area and see if we can help. Because when you're walking, you're having trouble walking and you haven't jogged for how many years?
Yeah. 3 years.
3 years.
Yeah.
So that'll be part of why you haven't been able to walk properly and haven't been able to jog. take your pulse first. So your heart rate is 80 right now. And I want you to lift your right knee up to your hand level with your waist. Now do the same with the other. Slide your hand along it, bring it up to your waist. Now do it faster. And again. So now I want you to do that on the spot. Everything works okay then, doesn't it? Now the problem is going to be not that you can't jog because your muscles aren't working, they're working now. The problem now is going to be that your heart rate goes up very quickly. Just relax as you jog to keep your heart rate down. The problem is your heart rate, not your muscles. Now, relax as you jog. Enjoy. Now stop here. Come over here. Now relax as I'm taking your heart rate to bring your heart rate back down. That went up to 100. Just that little short jog took it up to 100. It's not your muscles you have to worry about. It's your heart rate. Do you understand?
I know, but my knee felt a bit...
Your knee felt funny because it's not used to doing this.
Yeah.
It needs the exercise. Okay, now it sounded like you didn't trust me then.
No, I know.
I know what I'm doing. I've seen your x-rays. I've massaged you 4 days, checking your lower back. I've checked your spine. I know what I'm doing. All right, Myrto, now it's been 3 years since you've been able to jog properly. How do you feel after this morning's effort?
Great.
Feel great?
I'm shocked that I actually did that much. I mean, once I relaxed and let it go, I felt like I was flying.
Yep.
Literally.
Congratulations, girl. That was a really good effort.
Thank you.
You've worked hard all week.
Thank you so much. Thanks to you guys.
Okay.